All right.
All right, good morning, everybody. Glad to have you with me. This is Coach Whiteman on 360 Performance. Every Friday at 11 a.m., religiously bringing you issues about enhancing your human performance and being the best that you can be. Here at KUHSdenver.com, we are streaming globally. Can you believe that? Oh, in such a short period of time. We've gone global, people. It's awesome to be here with you today. We're going to be talking to a very special guest about a scientific term. We'll explain a little bit more about it, neuromodulation, and the science of the brain-body connection as I relate to it, but the neurology of that. You know, you have nerves in your body that cause your thoughts to be transported to muscle and bone, soft tissue, connective tissue. And for some of us, not me necessarily, we think, we do. But I'm constantly challenged with that, as people have told me. My thinking processes are sometimes limited. But I'm working very hard at it. So when I bring guests on like my guest today, I want to make sure that I turn the dials up where they're supposed to be. That's another thing. So there we go. Everything's modulating properly. That I bring people that overcome my shortcomings and give me a better view of the world. So I can learn. I can fight back at those people who challenge me. And I'm doing that today. And my guest today is Kelly Roman. He is the CEO and co-founder of Fisher Wallace, a company that you're going to explain this to me, Kelly, later, but I'm going to say that you're kind of pioneers in this field of legitimizing neuromodulation. And when I say legitimizing, I'm meaning that there are people out there that claim that they have science on their side, but haven't validated through scientific methods and strategies and testing, if you will. Getting the real scientists involved in validating the claims that you make on the benefits that you present. And in my world, I look at people like Naomi Osaka, a tennis player who recently admitted, you know what, stuff overwhelms me, like the press. I don't like talking to the press. It gets in my head. I need some time to process that. And she used the D word. She said, I've been depressed. I've battled with depression before. Well, interestingly enough, that seems to be a switch that gets turned on by the media and takes her down a rabbit hole of just like, I'm out of control. What is she going to do next? Is she going to be able to play tennis? Well, sure she is. I haven't met an elite athlete yet that hasn't dealt with anxiety and the energies associated with amping yourself up and get ready to play and doing your best. That's just part of the deal. It's not my place to judge whether that's clinical. I have no idea how influential that is on her. The same thing is true for Michael Phelps, who spoke up on her behalf and said, look, give the girl a break. I didn't like the press either, but I still have 13 medals from the Olympics. That's an amazing feat. Look at the person before you look at the message of that they're ill or they're hurt or they're struggling. We didn't ask her those questions. She's still going to play. And I'm also interested, we'll talk about this with Kelly a little bit, about the neuromodulation and its impact on the signaling that's going on in our body and how they can help regulate that and get us into a better place. So as I say that, I want to put this thought in your head. Mental conditioning before mental illness. If you're concerned about the flu, you go get a vaccine, right? I want to get an inoculation before I get ill to prevent the impact of the illness. We're not spending enough time on mental conditioning and the tools and support that we could use in that mental conditioning to prevent or diminish the possibility of mental illness. That's also a part that I want to share with you. So, without any further ado, welcome Kelly Roman, CEO and co-founder of Fisher Wallace, and some amazing technology that I really want to know more about in neuromodulation. So Kelly, welcome to the show. I'm glad you're here.
It's so great to be here. Thank you. It was great to hear that intro, and I think not enough people focus on preventative and really tend to focus on reactive treatment. So it's really great to hear you talk about that.
Well, and too often, unless you've had personal experience with it, Kelly, it's voodoo magic, right? It's something I don't want to tread there because I'm not sure what kind of a rabbit hole I'm going into. But with that being said, your entrance into neuroscience was one based on personal experience in some regards. You didn't come at Fisher-Wallace and the neuromodulation methodologies because you're a scientist at heart or from initial training. You were in the literary world, graphic novelist, well renowned for it in many regards in your fraternity of folks. So how is Fisher-Wallace helping you to kind of level up and take all of that experience and bring it to a place that you're rising up to a whole nother level of performance?
Yeah, no, it's a good point. I had maybe an unusual path into becoming a healthcare CEO. When I went to Harvard undergrad and was a creative writing English major, and I've always enjoyed storytelling and when I got out of college, I worked at a rehab center for children who had basically been removed from their homes and because of abusive or dangerous circumstances, and were put in what was essentially a boarding school, but a state sponsored one. But it was actually a very nurturing place. It was called Hillcrest. I think it's still going on. And I did that for about a year and a half, and my mother was a school teacher, so worked in second and third grade. So I think there were some influences there. And my brother is a research scientist. He's actually one of the heads of the cell biology department at SUNY Downstate, which is one of the top medical schools here in New York City. So I've always been kind of exposed to the science side of things, reading journal articles that he's published and so forth. And I kind of built up a marketing background in digital, working for Nielsen and a couple of startups. I did take a break and wrote a book for HarperCollins that adapted The Art of War, Sun Tzu's The Art of War. There's probably quite a few athletes out there who are familiar with that book, as well as all kinds of people. But my interest in that book, I found it inspiring to read, but I also found it kind of difficult to kind of read. It's kind of very dense and hard to kind of read like a book. And so I decided to turn that into a graphic novel because I thought it would be a more entertaining and accessible way to access the ancient text. And so I modernized the story, made it a near future sci-fi story that integrated almost all of the original text using a public domain translation. So that was a really amazing experience, something I kind of didn't expect to do until a couple of things happened. And then after I did that, I was looking for an entrepreneurial experience. I met my business partner, Chip Fisher, who also went to Harvard 18 years before I did. And so we connected over the alumni network. His original partner, Wallace, of Fisher-Wallace, had just died of cancer about a year into the project. And so he was looking for a new business partner, and the timing was right. I was just coming off of taking some antidepressants and had very limited success with them. I had some benefit over probably first 3 months, and then the side effects, the effectiveness kind of wore off for me, and the side effects were pretty difficult. I experienced the weight gain and kind of insatiable appetite. And so I was familiar with the basic struggles that millions of people go through in trying to take medication for that. And so I was intrigued by the device, and there was some research. They had already the device. He had acquired the device from the inventors. And when I used it myself and it worked for me, I said, well, I'm only an N of one. It's just me, but I believe it works for me. I haven't had to take meds since then. it's helped me sleep. It's done a bunch of things helpful for me. So I felt inspired to dig into this, and that was 12 years ago. So as you mentioned, we're a very science-first organization. We invested $2.5 million over the last year in 3 clinical trials that were conducted during the pandemic, and it was unbelievable experience to run mental health trials during the pandemic, where this is a situation in which depression and anxiety were up 300% in the U.S. Obviously, people it was the stress of the pandemic, the social isolation, the loss of work, everything that we're familiar with now contributed to that. And we had 800 patients in these trials. We had a placebo arm and an active arm. We had a crossover design, which means you take the placebo group after 4 weeks and you cross them over to an active device. And the studies were run by Kyle Lapidus, who's a well-known researcher associated with Mount Sinai here in New York. We had over 20 board-certified psychiatrists who were handling the telemedicine of this, because these are all remote trials at home.
Yeah.
The subjects at home. So yeah, we've come a long way, and I appreciate you describing our focus on validating what we're doing. And I think that is part of our mission, is to not just succeed as a company, but to really validate this as a technology in general. And before I talk too much, I would say there's kind of three. I look at there being kind of 3 epics of mental health treatment. There is, psychotherapy, and then that was followed by drug therapy, and now we're really entering an era of electrotherapy. And there's companies like ours that are making a non-invasive, wearable, affordable, easy to use. And then you have companies like Neuralink, which Elon Musk, funded, that is working on surgical brain stimulation. So this really is a category that, in general, that is taking off, and it's happening at a time when the country and the world needs mental health treatment more than ever. And hats off to Osaka and Michael Phelps and all the other folks. We just saw the Oprah and Prince Harry and Lady Gaga and all kinds of folks now are talking about it, and that's a really important, great thing, because it's like 40% of the country is dealing with depression and anxiety. So there's really no reason for it to be stigmatized, but of course it is, and it's nice to see that beginning to be addressed.
Well, and what you're talking about is a dynamic of over 120 million people in the United States alone that in some degree and fashion are faced with diminished capacity based on just trying to cognitively divide their day into buckets of managed behavior. And in my world, that still goes on, but they're trying to excel. Their physicality is at a level that's higher than most, and yet they still are faced with the same kinds of issues on a daily basis, making choices on what I'm going to eat today and who am I going to talk to, and did they talk to me nicely, and all your responses that go into just living life. It's interesting to me that what you've described is something that could be, as it progresses on the issues of anxiety, depression, and insomnia, as you talk about the product in its commercial sense, there's also that neuroscientific genre that Elon Musk and others, in my family, we have incidents of neuromuscular disease that we've dealt with over the years. I can only imagine what would have happened if this technology was available back in the day when my sister-in-law at age 9 was suffering through a neuromuscular consequence with dystonia, and being able to block some of those nerve impulses that caused her to be in the condition that she's in. Now, that being said, let me ask you this question for you then personally. What was the moment in time for you that you had that first impact about mental health that guided you towards saying, you know what, it's coincidental that I met Mr. Fisher and made that connection, but when in this whole process and experience for you that you said, the light bulb just went on. I'm going to try this. I'm going to be one of the guinea pigs in maybe you were in the trial, maybe you weren't, but it works. What caused you to want to be the person to put the headband on?
You know, I'm very much of attracted to the David Goliath fight, and I would suspect that I'm not a professional athlete, but you know, even if you're gifted, it must be an incredibly difficult journey. And on some level, the challenge has to appeal to you, right? And there may be very deep reasons for that. And you know, I think, you know, my experience, high performers, you know, the drive to perform can come from very deep places. And you know, for me, I think I was attracted to this challenge because I knew that there had to be something better than drug therapy, but I didn't know what it was. And when I came across this technology, and then I learned that you know, this technology actually came to market originally in 1990 when you know, Lexapro had been approved, and you know, Prozac had been approved just a few years before. And no one ever heard about this technology because the drug industry was, for mental health, was in its heyday. It was you know, throughout the 90s all the way to the early, you know, 2000s, when these drugs were in patent, they just took the oxygen out of the market in terms of they saturated the airwaves with ads. They had armies of sales force, you know, getting these into the hands of doctors and so forth. And so this technology, I kind of make a joke. I go to, you know, I say it was kind of sitting in that vault in the Indiana Jones movie where all of the secret things are. And it wasn't until Chip acquired it in 2006, 2007, and that was at a time when all these drugs were now just coming out of patent. You don't see ads for antidepressants anymore because of that. And so there was and that was also at a time when the internet was, as a marketing platform, was kind of democratizing the means of communication, right? So you didn't have to buy massive TV ads to reach an audience. So all those things I found to be very appealing as a challenge, and I felt like I always wanted to do something professionally. I wanted to make money, I wanted to be successful, but I didn't want to do something that I wanted to have some social value, some real social value, not just a tagline of social value. And this really obviously checked the box for me there, and so it was something I could really commit to. And I feel like not coming from a typical background into this was an advantage, because you know, I've had to become an expert in FDA regulation and clinical trial, running clinical trials, and all the things you have to know when you run a medical device company. But I approach things probably much differently than someone who has only lived in that world. So. You know, it just was a great challenge. I felt very motivated. I felt like it was a good combination of business sense. There's obviously a huge market, and social sense, social value.
So Kelly, you come at it from a very genuine place. You're experiencing it. You applied it to yourself from the experience you had in dealing with the pharma side of depression, anxiety, and what have you. Let's talk about the specifics. Neurostimulation, what is Fisher Wallace's method for applying the technology? How do you use it?
So it's the device, which is our version 1 device, and there's a version 2 that we're developing now. The version 1 device is basically, think of it as about the size of a remote control, a handheld device, and out of that comes a couple of wires that connect two electrodes, and you place those on either side of your head, basically above the sideburn.
Mm-hmm.
Under a headband is how it's designed now. And the headband's a little funny looking, but it actually works very well, and it's inexpensive and easy to replace. And these electrodes deliver electrical current to your brain for 20 minutes, and it does so. It's very comfortable. It's very safe. There's a 1% side effect rate, which is headache, dizziness. and it uses a package of frequencies to do a number of things that we have some evidence of in published research, which is it stimulates serotonin production, lowers cortisol. We use what's called alternating current, which means the polarity changes from positive to negative, switches, and that has been shown to entrain a brainwave state, alpha wave brain state. And it also has been shown in brain imagery to modulate the center brain regions, which are responsible for sympathetic response. So we can kind of, in a sense, modulate the fight or flee response. So there are some other mechanisms that are possible, and now that we've done these large-scale trials that look at symptom reduction, which is not looking at mechanism. So mechanism of action is a whole nother side to this. What we just performed were large-scale studies on, does it reduce symptoms? The answer there was yes. We want to invest next in actually fleshing out in a more clear way how it's working in the brain. That means doing some really modern brain imagery studies, some more modern biomarker studies. We want to look at things like membrane potential in cells, and you can do that by using some fluorescent dyes and doing blood tests. And so, we don't have a perfect understanding of the how yet. We have some signals, like I said, with the biomarker research that has been done and the brainwave entrainment. There's still more to go there. There's still quite a bit of unknown on how drug therapy works. But one thing we do know about drug therapy, of course, is that you have to swallow it typically for antidepressant or anti-anxiety medication. And so it has to get to your brain through your digestive system, which is a very inefficient means of delivering.
And there's side effects.
Treatment. So.
And there's side effects.
Go ahead.
And there's side effects.
Oh, well, I mean, that is part of the reason why there's side effects, right? So a majority of your serotonin production is in your gastro tract. So it's not surprising that a lot of patients who take serotonin reuptake inhibitors, which basically antidepressants, which are designed to, at least the first generation ones were designed to kind of block certain receptors so that from absorbing serotonin, so that serotonin would increase in the system. But if you're messing with how serotonin is absorbed in your gastro tract, which of course the drugs don't differentiate, you can have problems with hunger, with all kinds of things, gastro. That's why there's vomiting and other kinds of side effects there. So we avoid that by just delivering electricity to your electrical organ, which is your brain. Your brain is an electrical organ. It's very responsive to electrical stimulation, and it's clean. It's a clean, direct way of doing it.
So Kelly, can I administer this to myself, or do I need someone to help me?
No, you administer it to yourself. This is it's designed to be used by the patient, by themselves at home. I mean, you can use it outside the home when you're traveling. I travel with mine, but it really is designed to be fully autonomous, with the patient. You don't need to have administration.
Do I need a script to acquire it?
Yes, you do. So now, one of the, I won't say nice things about COVID, but one of the benefits to the healthcare system that occurred because of the pandemic was this increase in telemedicine and people's comfort level with it, and the number of companies that are. So it's actually much more convenient to get a script now via telemedicine. In many states, you don't even have to have a live interview. You can have a brief chat with the provider. So you don't have to kind of go into your whole history. It's really a pretty quick process. And, it's because it's so low risk and there's no contraindications with medication. You can use the device and take antidepressants, and there's no danger with combinational therapy.
Well, and quite honestly, we're learning about the layers of the onion of our brain, and there will be people who will probably need the medication as well as neuromodulation.
That can work very well. There are people where that is the ideal combination. Same is true with cognitive behavioral therapy. There's people who use our device in combination with talk therapy and other forms, and that's I think. I mean, typically you have to do more than just one thing to have an optimal result. And so, you know, I mean, I tell people if they talk to me and they say they're depressed, I was like, you know, the first thing a good psychiatrist would ask is, you know, what's your alcohol intake? You know, and it's like a simple thing like that, reducing or eliminating alcohol can have a pretty massive effect on your mood. And you know, and then obviously everyone knows exercise and diet and so forth. But so, you know, there's no just one cure for anything.
Yeah. So Kelly, there's the, you know, in our culture we have different opinions about lots of different topics, and as it relates to mental health, we're still discovering answers that fit. And fortunately, we're getting more questions, which is a good thing. So we've got institutions cropping up, offering product for health and wellness, like we've got the Doc in the Box from the Walgreens and the Rite Aids of the world. And then you have the unit of use physicians distribution networks that are basically script oriented, that you can actually order supplements through the unit of use distribution networks. How do we get your product?
So the easiest way is to go to our website, which is fisherwallace.com, and if you can either go there, you can go to your own doctor, and we have a form you can download and bring to your doctor if you'd like to talk to them about it, or we refer you to a telehealth service that you can go through that process. But the website fisherwallace.com has a lot of information on it that you'll probably want to read about on the science. You can see videos, you can read about what doctors are saying about it and what patients have said about their experience. We've sold over 70,000 devices now through 14,000 prescribers. So there is a large clinical record of this at this point, which is great, because then, you know, new patients can kind of get a lot of information about what it's like to use it. And then we have a 30-day return policy, full refund. It's an out-of-pocket purchase. We are, with these trials that we just did, we are going to be working on getting insurance reimbursement. But right now it's a $500 product with a full refund policy and free shipping both ways. We give you a return label. We get about 15% of them back. So 85% of our customers keep the device. And so, you know, it's for financially, it's actually makes a lot of sense, because if it works for you, it's certainly worth $500. You know, if it doesn't work for you, you can send it back.
So Kelly, some people are maybe a little old school. They like to go visit, the, you know, face-to-face interaction. Is the product being utilized with a patient going to a physician's office and just kind of sitting in the little room and getting it done? And then answer also the question, what's the frequency of, whether it's me administering it to myself, or I go visit my favorite physician or chiropractor or neurologist or whatever the case may be. Can I do that? Is that being done? And what's the frequency of the application?
Well, I'll answer that first. The frequency is twice a day, when you wake up and before you go to bed. Okay. 20 minutes each time. If you have even if you think you're sleeping well, because our indication by FDA is depression, anxiety, insomnia, and the mechanisms I described earlier impact all three of those. So it's twice a day, and then there are doctors that do use it in their practice. It's not like there's major clinics that you can use, that are all over the place that you can walk in and use this. That's not our model. Our model is really direct to patient home use. Yep. But for instance, in the state of Maine is the one state that actually has where Medicaid fully covers the device, and we want more states to do that. But in Maine, their requirement for a Medicaid prescription is that you go to the doctor and that the doctor uses the device with you to make sure that you know how to use it and that there's no, you don't experience any negative side effects. And I actually don't think that's a great requirement, because it's so low risk that to force a patient to come into the office, I think, is a little inconvenient. especially in Maine. I mean, a lot of people live in pretty remote areas, but that's how they set it up. I think it's a little bit of a leftover from the old days of drug therapy. But so there are doctors in Maine that we work with who have the device. But in general, it's really more, you would order it, it comes to the house, you try it, you use it for 2 weeks. I always say give it at least a week, give it 2 weeks ideally. If you're not seeing a significant improvement within 2 weeks of twice daily usage, then you probably are not going to. But that's a pretty small percentage of patients.
Well, you've had the experience. You've applied it to yourself. Give us a few examples of what you discovered as the tangible outcomes of using it. I mean, sleep is easy. Yeah. I get more sleep. I went to sleep at such and such, and I got 7 hours where I used to get 3. That's a pretty easy measurement. But what about the anxiety and depression side of things? What are some tangibles that you recognize for yourself?
So, I would say that the outcome of using the device is not just reduction of anxiety and depression. It actually is going from a place where you may feel like you're just trying to get by in kind of survival mode, so to speak, and you then, and this was my experience, and I know this is experience of many patients because we've interviewed them, you then you go from kind of survival into a place of being eased, where the symptoms are eased, and then you go into a place, say by the 3rd week, where you're feeling a level of lucidity, of kind of a clarity of thought and a peace, right? It's like and cognitive. Sleep, one or combination of those things, your cognitive function increases, and lucidity, of clarity and calmness, and we're really here to liberate the person from a state of being in kind of, I'm just very keeping it together, or I'm getting close to a wall. I'd say into that place where you're your best self. So I feel like it's brought out my best self, not just gotten me to a neutral place. So and that's why I continue to use it, and why because I use it without having a lot of symptoms, and we have many thousands of people who have told us that they plan to use this for the rest of their life, not because they're still battling the symptoms, but because they feel that level of cognitive improvement after they've gone through the process of putting the symptoms into remission. So that is really what the device can deliver, and why people continue to use it, long after they've kind of triaged the symptoms with it.
So you've given me some really good insights on your personal experience and the enhancement of continued use once you've addressed the symptoms that drew you to finding this device as a solution. But help me validate some examples of impressions, because I'm an observer. I watch behavior of high performance individuals, both in sports and business, and there are certain facial expressions, certain postures in their body, the way they walk, the way they tilt themselves or shift themselves. So when I look at an individual that's going to do a speech, and I knew going in that they brought me in to help them with their anxiety, their stage fright, I see things like they may have a good body posture skeletally, but they're not looking up. They're looking out in front of them and down. And yet, I'm imagining that when you use the twice a day 20-minute sessions, you're going to feel prideful. You're going to feel, my eyes are up. I want to make eye contact. I want to see things. Now, you may not realize that you've gotten over your stage fright, but you're certainly feeling better about you. Would that be something I could see as a result of what you've experienced in using the neuromodulation process? That those kind of behaviors?
Yes, and I mean, I've I think most people, unless they're really used to speaking on a stage, that's kind of a special experience. But I think for me, it's about preparation, right, and feeling like I'm prepared when I go on a stage or when I'm speaking in front of people, I would also say that for me, the device helps me with that preparation because I'm getting sleep. I feel like the cognitive function is high. I have, and I'm not going to say that using the device will get rid of that nervousness you feel before you walk out on stage, because that's a situational thing that I think probably just comes with experience. I mean, I've seen the Netflix specials of Jerry Seinfeld and who still say they feel that special energy before they go out on the stage, and you never know if someone's going to laugh when you're a comedian and so forth. But I think being prepared is basically the best thing, right? When you're whether you're an athlete or an executive, and so I think the device is certainly helpful in building that preparation.
Well, the next few questions I was going to ask you relate to exactly what we're talking about, which is quality of life. As the device addresses specific symptomatic issues, and once they've been addressed by utilizing the methods and the mechanics of neuromodulation, you're saying hang on to it, keep it, because it's going to sustain your quality of life. In fact, you may even find additional enhancements of other aspects of your life, if I understand you correctly, because you've personally experienced that. You're seeing a quality of life sustain itself.
Absolutely, it's not just me. I mean, we've interviewed many patients about this because we're building a version 2 device, and so I hired a branding firm called Pearl Fisher out of London, and we're actually going to rename the device, and so they interviewed a lot of patients, and the patients, again, these are patients who the device has worked, it's worked for them, right? But they view the device as more important than their cell phone. And I don't know how many, if I was, I mean, that says a lot, right? So I think the point is to like, if you're experiencing a reduction in anxiety and depression and improved sleep from the device, it means your brain's reacting to it. And so and one of the things we're doing in these next round of studies on biomarkers is looking at what I mentioned earlier is membrane potential, and membrane potential means the ability of a cell to kind of to send and receive information, chemicals, proteins, and so forth. And when the cell is young, it has a high membrane potential. As it gets older, it reduces that. And we've spoken with, the reason why we're looking at that is because we've spoken with cardiac surgeons who install pacemakers, and they install, which are electric stimulation devices, and they have alternating current versions of those. And when they've looked at the blood and these are actually, some of these are published studies, when you look at the blood that has passed around these alternating current pacemakers, they have noticed that the membrane potential increases in the blood cells. Now, if we're able to show that is what's happening in the brain, that would, with neurons, and that we're actually helping the neurons behave as if they're, say, younger, just more healthy, that would help explain why the symptoms are reduced, as we've shown now in the studies. So, we're still moving towards that. I'm bullish on that after having spoken to these pacemaker folks. But I think we need that data to tell that story a little bit better. But for me, and I know a lot of other patients, it's like if you've responded to the symptom reduction part, it's pretty, I want that. I want to keep using that. My brain's responding well to that. I want to keep using that, and I've noticed I've now been using it for years, and I just wouldn't want to stop it. There's no reason that I have to stop it. There's certainly no long-term negative effects, and I've just noticed improvements in just more like consistency. I just feel the consistency of high cognitive function, good sleep, and just in general, kind of feeling like I'm at my peak most of the time.
So Kelly, when you've done your interviewing of people that have applied the process in their own lives, have you come across those people that were already at a high level of acuity and awareness to their own body and mind connection? You know, they were nutritionally valued, they were meditation, yoga, all the things that stimulate different aspects of one's body to heighten their cognitions, to heighten their sensitivity and awareness of all five senses. And then when they applied neuromodulation to that existing state of presence for themselves, did they feel even greater sense of awareness and enhancement of their foundational components? Because the brain is one aspect of your entire body. I can still have depression and be very, very healthy. So I'm wondering, you talk about the tangential benefits that it extends to. I'm wondering if you've gotten feedback from people that validate that presumption I'm having.
Yeah, I mean, I would say, first of all, we have all kinds of patients across, culturally, ethnically, demographics are all over the place. In the interviews, there was a guy I'm remembering who is ex-military. He was in great shape before he started using the device, and was already doing a number of the things that you mentioned: diet, exercise, but he is also a CEO of a mid-sized company, and had quite a bit of pressure and very, very long work hours, and so was under a lot of stress, and found the device to be very helpful in being able to manage that and kind of give himself the peace of mind, literally peace in his mind, versus what sounded like generalized anxiety disorder before. And we've worked with Navy SEALs. We have a retired general, a U.S. Army general, on our advisory board who's a board-certified psychiatrist. He treats many veterans. In a sense, these are professional athletes, right? I mean, I would certainly call a Navy SEAL a professional athlete in many ways, as well as having to be very, in a lot of danger. And so, with the SEALs, for instance, they operate at night, and so a lot of them take sleep meds so they can sleep during the day, and then when they retire from service, we worked with one SEAL who had taken Ambien for 13 years.
Oh,
and so how do you then kind of get back to, when you're trying to get back to normal life, but you've been taking these sleep meds for over a decade. I mean, he was in great shape, but he had a lot of sleeping trouble and didn't want to continue to take Ambien, and we were able to get him off the Ambien. The device was so. It's really all over the place. I mean, there are patients who start using the device, I would say, at a very high level of professional status or athletic status, and then there's people who are coming to us who maybe used to be, or just are in really tough shape, and this has been something that gets them to a place where they can then start doing other things, right? There's a lot of patients who will use our device, and it just gets them into a stable place where then they can start thinking about, exercise and maybe their diet and things. But we definitely deal with patients who are coming to us in probably the lowest point of their life. And so, there's many people. There's a video we have on our website of an Iraq and Afghanistan veteran who had 2 suicide attempts before he used our device, and he talks about in the video how many different drugs he was on, and that after using the device, he's he has, he barely feels depression at all. So, these are the kind of stories, of course, that this is why I got into this business, as I mentioned in the beginning, and it's emotional. I mean, the people who work at Fisher Wallace, I mean, we have, live customer service from morning to night, 7 days a week. Most of those calls are pretty, predictable. We'll answer some questions, but we do get chats and calls from people who are in very tough places, and that's part of the job here. We can't just be a robot here.
Well, it sounds like, Kelly, that you're doing a lot to help support recovery from various different things, sustainability of the quality of life that either people are trying to attain or maintain. So I've got 3 words I want you to think about as it relates to your experiences. And cognitive longevity, tenacity, and resiliency. So where do those words fit into what you've experienced as it relates to neuromodulation?
Well, I think you have to have some tenacity to begin with too, because tenacity is about sticking with trying to solve a problem and trying to get to a better place, and even when things seem maybe a little hopeless. So tenacity is an incredible human trait. Resilience is very important. We're doing a study, we're about to launch one with the police department. I can't say which one yet, but a major urban police department, and they're looking at our device in that way, in terms of building resilience, and that's a very stressful job. You want your police officers to be able to make the right decisions all the time, and like the SEALs, you have police officers that work at night and have to sleep during the day and so forth. Resilience is really important in high stress jobs, but in general as well. What was the first word you said?
Cognitive longevity.
Oh, cognitive longevity. Obviously, I've talked about that just now in terms of why people and myself, why we continue to use the device. I tell my mom, I say to her, I can't tell you if the device is going to prevent or delay any kind of Alzheimer's onset, but let me tell you, I would use it now if I were you. And so she's going to use it, because she doesn't have any of the other symptoms. And I think that we need to build more data. I do believe, though, that we're going to find. I would not be surprised. Let me put it that way. Is if in a couple of years from now, brain stimulation will be seen as something that has that kind of long-term a benefit.
So Kelly, do you imagine that I should be investing in a retail space where I have an oxygen station as well as a neuromodulation?
Yeah.
You can walk in and get service.
Oxygen tanks are great.
Yeah.
No. I mean, those are, and I've noticed they have. I think I saw an Israeli company that has them really fairly affordable for the home.
Yeah.
But that's I mean, it's a little cumbersome, but those are great things.
Let me talk a little bit more about science as it relates to TBI, traumatic brain injury.
Sure.
Because I have physical therapists that I work with. I send athletes to them on concussive situations. And you mentioned about the cellular membrane health, and that electromodulation and the stimulation with electrical stimulation can improve the quality of that cellular membrane that allows the transfer of information, neurological transfer, to sustain itself, maintain its health. So have you done any studies where TBI was a focus and there was any kind of optimism in the results, that cognitive ability was increased and improved?
So there was one TBI study, but it was a safety study. It was not looking at cognitive improvements.
Okay.
We did do a Parkinson's study with our device at University of Maryland, where the subjects had improved gait and balance as a result of using the device. That was published. And there is quite a bit of academic lab research that's been published using not just our device, but kind of stimulators that they build in the lab that are alternating current, that show all kinds of cognitive benefits, focus, concentration primarily. The app that we're developing for version 2 of our device is actually going to likely have some cognitive tests as part of the app, so that you can actually track your own cognitive benefits over time. And so, one of the things, the device we have now, very effective, easy to use, but it doesn't have an app, and it's not a connected device. Not that everything has to have an app, but I think one of the things that the app will help us with in our next version is quantifying on a much larger scale how our patients and customers are improving. And we can anonymize that. We don't have to identify the patient by name or who they are, but we can have some analytics and have some tests and have that be something that the patient actually wants to see. How am I improving over time? If you want to also track your sleep, we can ship you a Fitbit or something like that. We used Fitbit in our insomnia study that we ran during the pandemic. And so there are all kinds of ways to quantify that I'm looking forward to rolling out with our customers, and so that they can see it themselves, and that we can also look at kind of a population.
Many of my PT folks listen to the show, and they're going to be, I can just feel their brain going right now, asking themselves, gosh, if I bought this device for the practice for my TBI patients, and many of their TBIs are non-athletes, they're car accident TBI victims, that kind of thing. So they've lost motor skill, movement, they've lost reaction time, hand-eye coordination, and what have you. So the patient needs to come into their office because they just physically can't manage the device. So they're going to ask me the question after the show, I'm sure, as we're talking, okay, how do I get this, and what do you think I should charge my patient for it? Because many of them are cash and carry now. They're not doing, insurance reimbursements are not very attractive to the physical therapy marketplace. So you at a low cost point, you fit a very, very interesting space for them. Because now there's VR goggles that can watch eye movement. They're extremely expensive and have subscription fees for the apps. And so the PTs are looking for documentable papers written that have quantifiable apps so they can track progress at a price point like $500 that's going to be beneficial. Is that something you want to get into and service?
Sure. I mean, I think we will have that. What you're describing with the app, that is going to be version 2. If you want to get a hold of version 1 and you're a provider, we do have a pro store on the Fisher Wallace site. There's a link to a pro store, and we do have I think 3,000 or 4,000 providers that do buy them, and so. I can't really advise on how to charge. I think on the insurance side, there are some codes for electrical stimulation that are kind of broad that can apply, and I think. But like you said, the device is inexpensive, and it's. I'm sure that there are doctors and PTs. By the way, it was a physical therapist who ran that Parkinson's study at University of Maryland. His name is Gad Alon, and you can find that study on.
That's
PubMed.
Awesome. That's awesome. Well,
and yeah, so I mean, that is certainly something we're interested in. To be honest, it's more of a bandwidth issue for me. We're not a large company yet, and so I kind of have to pick the parts of the market that I'm trying to establish. I certainly understand that that's a big one, and for anyone listening to this, the good thing about being a smaller company right now, a growing company, is we will respond to you very quickly if you email us or call us. So.
Kelly, do you want to continue with e-commerce through your website for sales, or are you looking at medical device distributors as well?
I think we'll probably always have some e-commerce, but we're looking at partnerships with big telehealth companies, and that have millions of patients who,
yep.
and they serve them for all kinds of things, a lot of meds. But I think once we have these, we're actually drafting our anxiety study results right now. We're going to be submitting them to a major scientific journal, and I think what's nice about the big journals right now, the big brand name ones, is that they all have rapid publication for anything that was done during COVID. So, and that may impact standard of care. So we check both those boxes. So I'm hoping we actually have the data that we just obtained published this year, and I think that'll help. I think get more rapid acceptance in a lot of communities.
I'm extremely grateful to you and the team that brought you to me, because it's definitely a fit that I'm interested in because of what I do outside of the show. I will be becoming a customer soon, because I have my own issues with sleep for a lot of reasons, the least of which
Sure.
is my rotator cuff tear that I had recently. So that's a whole other story we can talk about over a beverage. But
okay.
But I want to, excuse me, I want to ask you to end the show with me by sharing with me what about where you've been, the journey that's got you here to the place you're at today, and the gratitude that you feel. What are you grateful for today?
This may sound cliche, but I have a 7-year-old. She's about to turn 7 next week. Daughter. I'm grateful to have her. I'm grateful to be, hopefully a good role model for her. And just I'm grateful for my family. I mean, I think and for my health. I mean, I know those are things that can sound cliche, but especially after the year we just all went through, it doesn't seem cliche, and I am very grateful for those things.
Well, I have to echo all of what you just said, but I'll add for me personally that I'm grateful for the fact that humanity has responded in the way that they did to the pandemic, so that the awareness to health and wellness has been heightened, and yet specifically layered back to identify things that we really need to pay attention to. I say often with tongue in cheek that my King Soopers grocery store hasn't been so clean, because we're so much more attentive because of what we've gone through. And I'm hoping in that gratitude that we will continue to be observant to the details that make us better, and challenge everything and everyone to continue with that excellence of behavior in their awareness for what will make us better. It's just a great day. I'm glad I'm here speaking with Kelly Roman from Fisher Wallace, the CEO and co-founder of that, precipitously meeting a fellow alumni at Harvard to make that relationship happen. So thank you again, Kelly Roman, for being part of our show today at 360 Performance.
It was great to be here. Thanks so much. Really appreciate it.
Count on me reaching out to you sometime in the near future, Kelly. Have a great one.
Sounds good. Thank you.
Stick with me, Kelly. We're off the air.
Sure. Okay.
I don't know if you know this, but I have a pharma medical surgical supply company that's a client of mine in Tennessee.
Oh, okay.
And
okay.
they deal with